last one, it came in on.
Yeah.
And it was 50 cents, and this. No.
Jessica was on vacation that month.
Oh, okay.
So,
I didn't mind it.
when Trina sends it out, it was in the small envelope.
Two versions.
I must never give these to people, but since you said hi to me, it reminded me, there's my card and that's what I'm doing.
All right, thank you.
These young people are sitting here, I'll give them one too.
Thank you.
So,
How are you doing?
I'm good, how you doing? So I'm gonna be live streaming your meeting.
Okay, sounds good.
Yeah. I see you use an owl. You use that for this meeting?
No, you don't.
Okay.
No,
Thank you.
Thank you.
Did you bring this before?
What do you think?
Did you bring these ones before?
No.
No.
I came to one Board of Health meeting probably like 4 years ago.
Oh, okay.
So, but I don't think, I think it was not a COVID thing. I think it was either, it wasn't, I don't think that's why I came.
Mhm.
So,
You think there was someone else trying to take it.
Jessica, I didn't have that, that was at the end. Was it called the work? Yeah.
what do you do?
Oh.
You should have gotten a copy of Dr.
Yeah,
Kai's
I did that.
contract.
But it was on the email, it's just hard to read it.
Oh, yeah, yeah.
So this is the, you know, you can Jessica did. Almost every one of those contracts in there is
Yeah.
revised in your new
Okay.
packet.
Yeah, so there's gonna be new one in your packets.
Yeah.
They went through the prosecutor's office and got revised.
This is what I have.
Oh, yeah. It's hard to read even on the piece of paper. It's on.
It's Dave, good, how are you? How are you doing? All right, how you
If you're here for variances, can you go ahead and sign in?
Sure. Yeah. I'll grab this.
Or the-
Yeah. Yes.
The other side, so there's room for that.
What's up? How are you?
good.
You always gotta check, you never know.
I just had to make sure to move up in the order somehow.
They do move you around a lot here.
No, we don't have much.
Somebody's not here.
Well, I did move one spot. Year or so ago.
That's a huge.
Oh, yeah,
I was with you.
I'll scoot down one step.
I'm good. What do you got in that? What's going on?
No, just a little fuzz in here.
I lost my wallet last weekend. The bank did great getting my compliments to Amelia.
Oh, thank you. Oh, I'm sorry.
Yeah.
You didn't have cash.
Yeah, Nothing, nothing large or anything, it's just, I can't find it. It might still be in the house. I don't know where it is.
Check your refrigerator.
That's
That's where I find stuff.
Yeah.
They treated me good at the bank.
Good. That's such a stressful thing.
Yes.
That's why I never carry cash. I figure if I lose my wallet or get stolen, at least I can cancel cards.
Yeah.
But I've just seen so many customers come in and lose hundreds of dollars or get it stolen. Or you lose your wallet and they return it with cash. Katrina? What's going on?
There's a lot going on. I'm ready for a break. I got vacation at the end of the month, so. I haven't had a break since January. I just need to disconnect a little
Yeah.
bit. So,
Good there. All this stuff.
mhm. Thank you, Simon.
How's she doing? Is she working?
She is.
Sound pretty, pretty laid back and pretty patient, and like picking things out all the time, so. Yeah, right.
You know, it's just really good to see emptiness first, and then there's another adult now. Yeah.
That flying, and we're happy that everything's coming down, and like I said, her biggest thing is what she's.
Yeah.
My portion is on that.
Oh. Just one of these.
Well, yeah, true, but. That's how to do something. Probably did.
Did my turnaround.
A lot of them.
Yeah, I haven't heard from him.
That's how you're so excited.
Thank you for that.
Yes.
Yes.
Okay.
All rise for the pledge. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda. We have a motion and a second. All in favor? Aye.
All right, moving on to variances, Tyler's actually gonna take over and take them. The first one we have up is 6110 Taylor Pike.
So at 6110 Taylor Pike, a homeowner is here. They built or they're going to be building I guess an alteration to the existing attached garage, which they're gonna be adding 2 bedrooms. The home is currently a 3-bedroom home. It has a 3-bedroom sand filter there. Inspection history, the most recent inspection was passed. There were 2 failures in there. Those were for a broken lid. Has that been repaired at this point?
Yes, sir.
And then previously it was passed as this is a little blurry. This is just the floor plan showing that they're adding 2 bedrooms. Just a basic standard 3-bedroom sand filter. We are recommending disapproval just because the sand filter is designed for a 3-bedroom and not a 5-bedroom, obviously. And then, do you have any input beyond that?
Yeah, so just the only reason we're doing it is because we have a lot of children in the home. We have 6 children that live in the home, and we have 6 children bunched up into 2 bedrooms, essentially. And I'm just trying to give I got a 16-year-old daughter that I just gained custody of, and I'm just trying to give her own space that she's not sharing a room with 2 11-year-old boys. You know what I mean? Just trying to give her own space. We've been in the home for almost 14 years as this 10 people family, because I have 7 children total. So every other weekend, I have another child that comes. And the system has always been operational. I pump it out every year. Obviously, if anything was to go wrong, I would take responsibility and get that fixed, whatever is needed. But as of currently, for 14 years, it's been operating under the duress of 10 people. And I would imagine, even if I sold it in the future, that no family size of 10 is going to live in a 5-bedroom house normally. I'm a little bit outside the normal with how many children I have. So I was hoping that, being that it's operated normally and good and passed every year, besides last year with a failed lid, that it would be some exception for that.
With our current rules, we can't add to a sand filter.
No. So the sand filters are legal to exist. They are not legal to build. So we can't alter it.
That's what I thought.
Yep.
So it sounds like they're gonna have 10 people on it regardless of whether they get the bedrooms or not, so.
Exactly.
Yeah.
Okay, I'll second.
We have a motion and a second. All in favor?
Thank you.
Everybody who's here for variances, once your variance is approved, on it, if you're waiting on any paperwork from us, for building department or anything like that, they'll have it tomorrow afternoon. You are welcome to stay. This is an open public meeting, but you're not required to. So if you have something else, you're free to go also after your variance has been heard.
I have one addition for you. Because we never had an application, this one came in sort of mixed up. We will need you to make an application.
Okay.
And I recommend you talk to them up front.
Yeah.
If you have any questions, you can give me a call as well.
It sounds like I'll be here tomorrow for the building because they have some other stuff they want to see on my drawing.
Yep.
So I'll have some alterations I got to bring back for smoke detectors and stuff like that. So when I bring that back, I'll file for the health department one and kind of go from there.
Thank you.
All right. Thank you, guys.
We'll move on to the property address is 5977 Hunt. we have a homeowner here for that property. So this is connecting a new home to an existing system. My understanding is that the old home had been demolished.
Correct.
So it is a Wisconsin mound. Previous inspection was passed, and before that it had been vacant. Or actually, I'm sorry, the older inspection was passed and then it was marked vacant in the most recent ones. We've not had any failures that we know of on the property. It will, if they connect, it's going from what was previously a 3-bedroom house to now a 3-bedroom house. If they connect, it will require an alteration permit, and I believe you've already applied for the alteration permit.
I believe so, yes.
Or at least there's an alteration permit in there. I
Yeah,
don't think you
I
paid for
paid
it.
for that.
I don't think you paid for it yet, but it is sitting there waiting to be paid for. Just a sketch of the house and where the system is. Proposed house, there's an existing tank, the mountain would be right behind it. Oh, sorry, staff recommendation was approval on this one.
Second.
We have a motion and a second. All in favor? Aye. Thank you. Have a good day.
Yeah.
The address for the next one is 382 Dunn Street. This is a isolation distance from a addition that is going on to the home. According to the floor plans that I received, there will be the same number of bedrooms after the addition as there are currently. The new addition will be about 7 feet 3 inches from the tank, and about at minimum 9'4" from the actual leach line that is there. We couldn't find anything more than a single leach line at the property, but it is down in Miamiville, so the soil there is pretty porous. We are recommending approval. It's only minimum distance from the tank is 7 feet.
So moved.
Motion and a second. All in favor? Aye.
And that's all the variances.
Thank you. Thank you.
All right, do we have anyone for public comment?
Yep.
Next up, you're gonna have the approval of the medical director's contract. I do want to point out in what I had sent to you, the contract was correct. There was a typo in what I had sent, which was that I said an increase from $50 a day to 75. It should have been an hour with the daily rate remaining at 800. The contract language is correct. Dr. Kai is agreeable to it. I just wanted to point out my typo in the report.
Motion? So moved. Second. Motion and a second. All in favor?
Aye.
You're with us another year, huh? Thank you.
At least, so. All right. Next up, I would like approval to reclassify our emergency response coordinator position to a registered environmental health specialist position. You do have a copy of our organizational chart. So just to give you some background information, the state has communicated to us that our public health emergency preparedness grant that starts July 1st, or started July 1st. On it, part of the award was delayed. So we have 72% has been given to the state. They have been told the other 28% is coming. It has been allocated at federal level on it. So we do anticipate it coming. With that being said, we anticipate any cuts to the federal budget right now will impact us July 1st of 2026. So prior to the last person we had as the emergency response coordinator, it actually used to be classified as an REHS too, and I want to take it back to that. We did some switching with it when actually Tyler was in the position, because we had the position take on like some special projects additionally and do some other things where they really weren't working in the capacity of an REHS. So we want to go ahead and change it back. I did talk to the prosecutor's office about it on the reclassification. The position is vacant right now, so it has no impact on any person's existing position. What we would be doing then is opening it up to basically anyone with those credentials already, at least doing internal interviewing for it. It doesn't have to be an open posting because it's actually not a new position. It is going to actually be a change in job duties for an existing REHS too that would be on staff. So I put some additional information just regarding the fact that we're really hoping that they'll spend about 60% of their time doing emergency response for the FEP grant. We will then be slowly transitioning them to doing some accreditation work for us also, but they are still going to have to be probably in one of the either environmental health or water and waste in one of those programs. So they would still need to remain classified as the REHS too. But I do need your approval to reclassify that and update the organizational chart.
Motion in a second. All in favor? Aye.
All right, next up is the approval of the personnel policy, section 1208, electronic signatures. One of our grants requires that we actually have an electronic signature policy. So when we started writing this, we wanted to make sure it was applicable across the entire agency. Mulaney worked on putting it together, and then it has been approved by the prosecutor's office. There was some minor tweaks in the language on the last one, but it was just grammatical. It didn't change anything that was in effect in the policy. So I needed approval for that.
Motion?
Second.
A motion and a second. All in favor? Aye.
Next up, we have approval of the contract with the Health Collaborative for facilitation of our community health improvement plan. So we worked very closely with the Health Collaborative when they did the community health needs assessment, and we were very impressed with their kind of facilitation capabilities. So Terry and Mulaney work on our Claremont Partnership for Health, which really facilitates kind of, we initially do the community health assessment, which is like our data report, doing like the snapshot of the county. And then that leads into our community health improvement plan, which is the priorities that the health priorities that everyone's working on in the community. And so lots of partners involved with that. We would like some assistance. We are running a little bit short-staffed with some vacancies right now. So I would like some assistance in facilitating that process. The contract is for $6,300. It has gone through the prosecutor's office, but we are currently waiting on some insurance documents from them. So I would ask you to go ahead and approve me signing it once we contingent upon getting those insurance documents.
A motion and a second. All in favor?
Aye.
All right. I had asked you last month for permission to approve purchasing environmental health software, and you had granted that. What you had given me approval for last month was the, do you have Nats? 43,000 in implementation and 27,000 in annual licensing fees. Based off of the quote that we had from the company that we were looking at, we had compared quotes and what we were looking at selecting. So We have worked on doing contract negotiations. They initially came back and we're going back and forth on contract negotiations. And so, I sent documentation to them just regarding some of the concerns with the contract on it. But they also changed the pricing, and we're not sure what happened because they lowered our licensing fee for the first year, but then they increased our implementation fee. So it puts it above what you gave me approval for, only on the implementation side. The total is still under, so I just want to clarify with you and re-ask your permission to just leave it at the total of 70,000, and I will continue to negotiate between licensing fees and implementation costs. Additionally, I do want to make you aware of that they put in the contract on it, increases from year to year on the licensing fees, and that's pretty typical with software that the licensing fees go up.
Did they give you a percentage?
It's odd. So we also have questions over it. From, the first year they're reducing our licensing fee to 18,715, but they increased our implementation to 44,145. So the first year, which is really year two, our corrected annual licensing fee goes to 26,775. I'm fine with that. It then bumps to 30,546.60, which is a $3,800 increase. It then goes to 32,379.40, which is like an $1,800 increase. And then year 5, it's 34,322, which is a $1,900 increase. Like there's no rhyme or reason to this. There's not, I can't come up with the percentages or a dollar amount. So we are continuing to negotiate on the contract. We are going back and forth. We sent everything off to them today. It has gone through the prosecutor's office just for legal review. There's some additional things that, because we can't sign a indemnification clause, there's some additional things that are going back to them. I just want to be perfectly clear so that you understand this, the board, what I'm asking for. So I'm not changing the total. I'm just saying, can you just leave it at the 70,000? I didn't feel comfortable moving forward since I'd asked for implementation and licensing fees. And then just you being aware that there likely will be increases in year 2, 3, 4, and 5. That is again typical with software, but we're going to continue to negotiate with them on a contract. I need some rationale behind because I tried percentages. I don't understand why it is what it is. So, but I would like a motion so that it's clarified.
No motion.
So moved.
No motion and a second. All in favor? Aye. So we haven't started using the system yet, still using the old?
No, well, we're still on the interim system. No, we have not started because they won't turn the legacy system on until we have a signed contract. So it's okay. I mean, we'll continue to work through it. I'm sure we'll come to a resolution on it. I'm just not sure why we went from a quote that said one thing to a contract that said another. So we're trying to vet some of that out.
When you negotiate, just tell them you got a very hard-nosed board.
So while I explained to them that I can't sign it as is because it's outside the parameters that you gave me last month. With that being said, like a whole month has rolled around in that time frame. It did take a little longer. They actually got us the contract back on June 29th, but it took a little longer because it had to go back through the prosecutor. It should have been a simpler contract. Like they know we're an Ohio government entity, so there's certain clauses that can't be in there, but they gave us just a standard template. So all of that has to be either rewritten or removed.
They've worked with other counties before.
Yes, they have worked with several other counties in Ohio, so they should have known what contract language to give us, but we'll continue.
Nuisance.
Public health nuisances. So the resolution declaring properties public health nuisances on it. It's the resolution declaring public health nuisances and ordering abatement of nuisances at identified properties. I'm assuming you're good with me reading that by title only.
Yes.
All right, so the properties that are listed is 2623 Runaway Avenue, Bethel. There's garbage not deposited in proper waste containers. Animals are kept in a manner which creates public health nuisance. Garbage is not removed and disposed of in an improved manner at least once a week. In 1993 Cedarville Road in Goshen, garbage is not deposited improper waste containers. Pooled or contained water has stagnated and become the breeding place for mosquitoes. And there's an unsecured dwelling or unoccupied property. So first, I need a motion to waive the 3 readings.
So moved.
Second.
Mr. Seal,
Yes.
Dr. Khan.
Aye.
Mr. Meathers.
Aye.
Dr. Rickabaugh.
Aye.
Mr. Brown.
Second, I need a motion to declare the resolution an emergency.
So moved. Second.
Mr. Seal,
Aye.
Dr. Khan. Mr. Meathers.
Aye.
Dr. Rickabaugh.
Aye.
Mr. Brown.
And third, I need a motion to approve the resolution declaring public health nuisances and ordering abatement of nuisances at identified properties.
Mr. Seal.
Aye.
Dr. Khan. Mr. Meathers.
Aye.
Dr. Rickabaugh.
Aye.
Mr. Brown.
Next up, you have the bills.
$96,000 for a car is a lot.
There's 3 cars.
3, okay.
3 cars.
I didn't read that. I was like.
Yeah, no, it's 3.
Okay, I'm glad.
They're the 3 that are sitting in the parking lot that you, when you pull in, they're out there. They're Ford Escapes, hybrids. Hybrids, cheapest one, yeah. We didn't get hybrids yet, but they're.
That's good clarification.
Yeah, and now all 3 be going to our water and waste division, and then we have 2 Jeep compasses that will be auctioned off.
Is that Valvoline's working out?
Mhm.
So moved.
I'll second that. First and a second, all in favor?
Aye.
All right, so I'm kind of combining your discussion and Board of Health education for this month on it. So to give just a couple updates, some of the things that came out of the state budget bill that was just approved impacting us. So the public health lab, which we do use, it does all of our rabies sampling, and also if we have any communicable diseases that are coming in that may not be able to be tested in a private lab, or we want a quicker turnaround on it, they all go to the state lab. So while not directly out of our budget, it's the Ohio Department of Health's budget, but they did include $5 million in each fiscal year for the public health lab, which increased their state support from 3.9 to 8.9. The lab needs some significant upgrades. It really hasn't had much done to it in several years. And in fact, that's their first increase in general revenue funding since 2015. Help Me Grow Families Connect. They did increase the budget, so there was a goal to do the Families Connect program, which is similar to Help Me Grow nurse home visiting that we used to do years and years and years ago, and then they stopped it. And they're looking at re-implementing it just because of infant mortality. So the original budget had asked for a significant amount to be able to roll the program out to all 88 counties over the next 2 years. They did not get that, but they did get an increase from 56 to 60 million in fiscal year 26, and then 63 in 27. Lead abatement was completely pretty much eliminated. And unfortunately, a lot of that funding went to the local level to deal with lead exposure in paint in homes that children can be exposed to. So they eliminated ODH Lead Safe Home program completely. It was completely wiped out. And then the lead abatement program funding was reduced to $250,000 in each fiscal year, which in reality is barely enough for the state to kind of run the program. As far as the county budget commission, there was originally something put in to replace, to remove the prosecutor and replace the county commissioner on it. The final budget would not replace them, but it wouldn't replace the county prosecutor. but it would allow, if a prosecutor would recuse themselves, then I believe they can be replaced by a county commissioner. There were two items added as we were going kind of through the state budget process. They were both regarding septics. So there was an amendment put in to prohibit soil evaluation, which we need to site and put a septic system on with it. And then there was also a budget amendment that required ODH director to adopt rules governing sewage treatment systems, but specifically to adopt rules that established a statistical means for evaluating sewage treatment system compliance for A12 and soil depth credit relative to bacterial parameters that are derived. So going on, that are derived from a minimum of 144 consecutive data points. So interestingly, these are the same requirements that go through the Sewage Technical Advisory Committee. I think there were manufacturers that didn't want to have to, like the current process is they have to go through the Sewage Technical Advisory Committee. And I think they were trying to usurp that. Both of those were line item vetoed out of the budget on it. And then just a couple other things. There is a requirement for all political subdivisions to have a cybersecurity policy. Because we do get our services through the county, we'll be working with ISD on that. And then the burial permit fee went up from $3 to $10. But the bulk of it, we only get 50 cents of it anyway. The other 250 went to the State Cemetery Registry Fund, which a lot of our townships, I think, somehow use the funding through there on it. So the $9.50 will go to that. We still only get 50 cents off of it. Any questions on any of that? All right, I am gonna let Trina take over. So as you recall, I think Joe had actually requested at our April meeting to kind of look at some of our programs and like profit loss on them. If we truly didn't, like if they had to stand on their own. So Trina's going to present the information on it. Keeping in mind, this is truly based off of like the time we spend in the programs. So it's figured off of our time that we code into our insight for our daily itineraries. With that being said, data is always only as good as what gets put in there. But I think Trina's done a fantastic job of trying to put together to give you an idea of specific programs. And also she's going to cover what's mandated and then what are some of the options that you can do. Oh, I can't, sorry.
So you do have this handout in today's packet. All right. So how the report is laid out is you'll have our mandated fees first, and then I broke them down by group or kind of our division, and then the actual program, and then their 2024 profit or loss. So in our mandated programs and administration, very small, family and children first, and vital statistics. Vital statistics, we do make a profit on. It's actually been the subject of, we have a fiscal officer listserv going around in Ohio, and a lot of people are looking at increasing their vital statistics fees. We have not discussed that yet. The state is implementing a new vital statistics software program and also increasing the cost of paper. We'll likely wait and see what the actual ramifications of that are. They've been talking about statewide issuance on death certificates since I started 14 years ago too. So if that ever happens, that's definitely going to have a big impact on us, both potentially revenue wise, but also workload wise, and we may need to increase staffing there. So we'll sit tight at $25 right now. That is a healthy program. We move down to environmental health fees. So these are food service, schools, kind of our licensed programs. 2024, we did see a $49,000 loss. That's expected, just how our fees are set. We're always working 2 years behind. So use 2024 data to help set 2026's fees. So environmental health programs typically do kind of wax and wane. We'll lose one year, but then we'll turn around and we'll gain another year. But the way the methodologies are set up and set by state is we overall don't make a profit. Fees will decrease if we make a profit.
So is rabies, is that the negative 28,000?
It's an unfunded mandate. We receive no, we're mandated to do it. It's a mandated requirement. We receive no funding to do it. So that has to come out of our local general revenue.
It's what goes into the 28,000? Is that like all the
It's,
testing or is that time?
it can be,
Time.
yes, testing, and so environmental health has to investigate every animal bite report that comes in, and determine if the animal has to be quarantined, if it's up to date on rabies shots on it. If there is testing, if an animal would die during quarantine, or if it has to be put down prior to on it, it would go up to the state lab for testing on it. Again, they're doing the testing for free, so that wouldn't necessarily be included in our cost, but it's our staff time in that program.
Yeah, if the homeowner or the pet owner does not take the animal to the vet to be released, then our staff has to go out, verify the animal is healthy. So it's that kind of time as well. Other programs, schools, and I think schools is the only other mandated, unfunded and environmental. Vending, if you'll recall, is capped by the consumer price index. So a $750 loss isn't terrible on that one. We're never going to recoup our costs on that. Then we move into kind of our general programs. So this is our accreditation. We are mandated to be accredited. Work organizing the Board of Health, our community health assessment, our CHIP, DAC, emergency preparedness, and then you get into the fiscal, human resources, IT, kind of that overhead activity that every business and every agency is going to have. Again, those are kind of just your cost centers. So looking at a $515,000 cost there. Nursing, Claremont Partnership for Health, formerly this was CAM, the Coalition for Activity and Nutrition. Communicable disease is going to be our big one there, $66,000 cost. We don't receive direct funding to investigate communicable diseases. Moving down to water and waste.
Yep, no, I just wanted to point out child fatality review also is an unfunded mandate, but required.
Water and waste, again, these are permitted programs. I believe I don't think there's any unfunded mandates in this program. Did see about $153,000 loss. Water and waste is a hard one when it comes to fees. We don't like to update those fees every year, mainly because operation permits, operation permits aren't renewed annually. Some are renewed every 19 months, some every 38 months. So it's not really fair to homeowners to change the price for one during the cycle. So we typically try to wait about 3 or 4 years to update our water and waste fees. We did update several for 2025. So this year we should see hopefully less of a loss on that program. So of our mandated programs, looking at about a $645,000 loss. Programs that are expected, so we're not mandated by law to do them, but we're pretty much required, whether it's by public opinion or just expectation. Institutions, so this is inspections of the jails. Building and facility management, communications, communications and planning are two of our bigger cost centers there. But as much as the public doesn't like us, sometimes I bet they'd like us a lot more, dislike us a lot more if we weren't communicating with them. So a lot of this money is for our communications coordinator and the community outreach that we do. TB and backflow prevention, we actually conduct these programs on behalf of other agencies, and we do make a profit on there. So that helps alleviate some of the cost of the other programs. So we're looking at almost a $250,000 cost on expected programs. Then finally, we get to the unmandated programs. AOHC Executive Steering Committee and Administration, environmental health, out-of-county mobile, so we're not required to inspect mobiles that are licensed in other counties, however, if they're in Claremont County, we do want to make sure that they are operating properly. Person in charge, serve safe, these are two opportunities to make money. Person in charge, this is slightly skewed. I believe we held our person in charge class earlier in the year, so a lot of the payments for that came in 2023. Serve safe, we do make a profit on to help bolster some of those unfunded programs. Is smoking, and nursing, a lot of these programs, overall grand total is looking at $822,000 negative, which is pretty scary. But then you come back up, and this is actually, I think, on the bottom of your page. We have our supplemental income, so sale of equipment, miscellaneous payments we receive, our Milford contract, and our township and village monies, and then our state subsidy are our biggest contributors. They don't go to a specific program though. They go to support everything else. And also our workforce development grant. This grant does end in November of 2027. Yes. So this about almost $250,000 a year will be going away soon. So we will have to make that up. $37,000. However, once you back out cash advances, which internally look like revenue and expense, and then chargebacks for payroll, capital expenditures, and depreciation, that does leave us with a net change in position of about $89,000 for 2024. Any questions? You want to look at it any different way? We can sort however you like.
Is there any cap to net income that you can't be over? That makes sense. Like, can we not make more money than a certain amount?
Not necessarily. And the way our environmental health fees are structured, when we do the cost methodology, if we make a profit in one year, it's going to force us to lower our fees, and then we're gonna end up taking a loss, and we kind of go back and forth that way, but there's no dollar amount. And we, at the end of the year, we do need to have cash carryover still. Our goal is to break even though, like, our goal is to not make money. It is actually to break even, but you know, so keep in mind, she's looking at 1 year's worth of fiscal data for last year's 2024.
Yeah.
So if we had staffing gaps in there, we would have budgeted for those positions to be fully, you know, there, you have to budget to have those positions there. And things change throughout the year. We may put in our budget that we're getting X number of dollars in grants, and then our grants, we have some that run on a state fiscal year, we have some that run on a federal fiscal year. So we may get differences in there. It's why typically when we bring to you guys the February budget because we have to have it approved early, we always kind of do a reset when we do the appropriations budget in November, and we'll make the adjustments then to try to come closer, because a lot of times we'll know what health insurance benefits are going to be, you know, by then, if what increases we're going to get. We typically know what our upcoming grant awards will be, or at least closer to it. And then, you know, again, Tom does an excellent job trying to project like what's happening as far as, are we going to continue to see growth, which would impact like plumbing, or are we going to start to, you know, drop off, and then we need to take that into consideration.
Yeah. And then we'll have, this is July, so next month we'll start bringing fee adjustments to you for the programs, and that'll also help me fine tune the 2026 budget.
All right, so just so I understand, so in 2024, we're roughly $90,000 ahead. Not that we want to make money, but all right, so that's where it landed. And 2027 will be out $250,000. So that is 160, just assuming everything stays the same, it won't, is 160 short. Where does that come from? What's at risk?
There's a plan for that.
Okay.
So there's always a plan for that. You know, I have a plan for that. No, when we brought the workforce funding to you, we created 2 additional positions with it. The intent is those positions will go away through attrition. We may carry them on cash reserves for a short period of time, but there will be turnover in staff that we are projecting over the next 3 to 4 years, which will allow that to, you know, you might go down 1 year, but it'll be recouped the following on it. So right now it is supporting Mulaney's position, and then a second epidemiologist. So.
But does that look, how does that affect any programs, or does it?
I mean, things are gonna get really tight. I'm gonna be honest with you. I need 2 full-time epidemiologists to be able to do the work that we are supposed to do. I will only have funding for 1. And, you know, there's nowhere to really go to get that funding unless you want to go back to the townships and villages and ask for additional inside millage, and I do not suggest we do that. So, I mean, we're just gonna have to figure out how we continue to do what we can, tighten the belts. You know, I am a member of our state association. We continue to work for different ways that we can find funding. At some point, can we try to get funding for some of these unfunded mandates that we have? You know, we have thrown out some ideas and different ways of doing things that we might be able to increase our revenue. We would love to be a solely sufficient agency, but that's just not practical. Given the things that we are mandated to do. You know, I don't know where you go get funding to do communicable disease, but we are mandated to do it. You know, there's no revenue source for that. I have ideas about like how we might be able to get some revenue on things, but those are going to be required legislative changes, like in order for those things to happen in doing that. But that will be the biggest hurt, is going to be losing probably at some point in the future, losing that second epidemiologist. There's a lot of data crunching that they do. They do the child fatality review, suicide fatality review, the overdose fatality review, as well as helping out on the community health assessment that we do. We try to provide data to our partners too, to help them if we can, so that they can write grants and bring in funding and do some of that. And those are things that we just may not be able to do anymore. So we'll see when we get there, but I think things can also change between now and then. I think we'll really have to take a look at what cuts we end up getting from the federal on down, and then if there ends up being any additional changes with state legislation. So,
Thank you, that was a lot of work.
all right, I do not have any additional information unless you guys have any questions.
Take a motion. Let's get out of here.
Do it, man, do it. Do the power. I'll second it.
Motion and a second, all in favor? Aye. Yay. As soon as the wind cleared out, cooled down a little bit in here. It's not as bad.
Yes, I think it's false radio. It always is, but sadly, if you come in the morning, like, it's, the air conditioner's flat. So, but like, when the sun hits this side of the building, because my office is the same